can start from the pediatrics because they are asking a lot of questions from pediatrics. So the one question that they asked was the Kawasaki treatment. Okay. So any idea? So the question was the most accurate treatment for Kawasaki disease.
IV immunoglobulins.
Yeah, so it is IV immunoglobulin. Okay, again, even the aspirin is also given, but if they ask you the most accurate treatment, then it is always IV immunoglobulin. Okay, so I'll just show you about Kawasaki disease because sometimes they can give you some symptoms also. So any idea regarding any symptoms of Kawasaki disease?
Strawberry tongue, conjunctival ingestion.
Yeah, strawberry tongue. Okay.
Unilateral cervical lymphadenopathy.
Yeah, lymphadenopathy. Okay.
Okay,
again, yeah, what is the problem of this Kawasaki disease? Why should we why should we treat this patient as quick as possible?
It will affect the coronary arteries.
Yeah, so coronary artery aneurysm is one of the complication. Okay, so that is why it's always very important to treat a child, especially with Kawasaki disease. Okay, so I'll just show you. So remember, IV immunoglobulin is the treatment. Okay, so that was asked for the exam. So I'll just show you the other features also. Just give me a second. Okay.
Yes.
So like as we said, so here the problem is it is seen usually in small children. Again, another problem is coronary artery aneurysm is the most important complication of this condition. Okay, so that is why if we see any of these symptoms like fever, then conjunctivitis, again, the child will be having rash. Okay, again, usually the rash over the palms and soles, usually it will peel off. Okay, so deformation is also a feature that is seen in Kawasaki. Then cervical lymphadenopathy, strawberry tongue. Okay, all these features are seen. Again, can you give me another condition with strawberry tongue?
Scarlet fever.
Yeah, scarlet fever. So scarlet fever also like somewhat similar, like the child can have fever, then strawberry tongue, again sore throat. Okay, but what is the most common organism that causes the scarlet fever?
Streptococcus.
Yeah, it is streptococcus. Okay, so definitely we need to give some antibiotics. Okay, so if it is scarlet fever, always look for the other symptoms also. Okay, again, rash is also a feature in scarlet fever. But when it comes to Kawasaki disease, the extra features like conjunctivitis, then other features also. Okay, again, most important thing is IV immunoglobulin is the treatment. Okay, so that is important. Again, another question they asked was, which is they actually gave some symptoms of coarctation of aorta. Okay, then they gave which condition is associated with the coarctation of aorta. So any idea? So I'll give you some options like Down syndrome, then Edwards syndrome, Turner syndrome, Klinefelter syndrome. So what could be the answer? Yeah, it is Turner syndrome. Okay? So Turner syndrome is actually associated with the coarctation of aorta. Again, like any idea regarding the coarctation of aorta, because that is also a probable question. Sometimes they can ask you some features of coarctation of aorta. So any idea?
Radiofemoral delay.
Okay. So coarctation of aorta, first of all, the question that they asked was its association. Okay, so it is associated with the Turner syndrome, very important. Okay, again, like sometimes they won't be giving this Turner syndrome. Okay, so the other way they can ask, they can give you some features of Turner syndrome and then they can ask which condition, which heart condition is associated with that. Okay, so what are the other features of Turner syndrome?
Short webbed neck.
Yeah, short webbed neck. Okay. Then short stature, then shield chest, okay, all those symptoms. Again, when it comes to coarctation of aorta, mainly if it is child, the child can present with respiratory distress, then heart failure, then radiofemoral delay, okay, all these symptoms. And usually there will be a murmur also, okay. So the murmur that is heard in coarctation of aorta is mid-systolic murmur, okay. So these are few things that you need to know.